A 35-year-old pregnant woman gravida 2 para 1 at 34 weeks of gestation presents to you in emergency with significant vaginal bleed. She also complains of pain in the abdomen. What are your differentials? Well, there can be many. Let's dive into it. Hi, welcome to K-Medicine. In this video we are going to talk about placental abruption. We will talk about its definition, pathology, types, risk factors and diagnosis of placental abruption in this part. Complete management and investigations will be studied in the next part. It is a medical emergency, so it is very important to manage it according to the maternal and fetal well-being. We'll talk about it in detail, so let us start. Placental abruption is one of the causes of antepartum hemorrhage, which is a hemorrhage occurring at 24 weeks or beyond of gestation and before birth. There are multiple causes of bleeding in the second half of pregnancy. A complete history and examination can narrow down the differentials for you. It is actually the premature separation of placenta. The separation can be complete or partial, as we will see later on in this video. Placenta normally does separate after birth, but here it is separated before birth. So when a woman, in her second half of pregnancy, presents to you with vaginal bleeding along with pain in abdomen, the first differential that should come to our mind is placental abruption. Bleeding could be just like spotting, or it could be a heavy bleed. It depends on the different types of abruption. Pathophysiologically, the maternal vessels and basalles of endometrium supplying the placenta rupture, leading to leakage of blood and subsequently the separation of placenta. As you can see in this picture, how the normal placenta is, how blood leaks and how a clot is formed. Moving on to the types of abruption. So there are 3 main types of placental abruption, and their presentation might also differ. Complete separation or a concealed abruption, partial separation or reveal abruption, marginal separation. This one is also a revealed one. A complete separation in which there is complete separation of placenta, and here the blood pools and forms a retroplacental clot, causing abdominal pain but bleeding is concealed. It is so severe sometimes that it may cause maternal shock. This type may cause significant fetal heart rate abnormalities. A partial separation is the one in which only some part of placenta detaches. Bleeding can occur, as you can get from this picture here. This one is called the revealed type. In marginal separation, the margins of placenta are separated only, as you can see here. Only the margins are separated. Here again, bleeding can occur. Risk factors can be many. Most important are previous history of placental abruption, chronic HTN, advanced age, multiple pregnancy, smoking or choriomyonitis. Trauma is also an important cause. Rise of alpha-fetoprotein levels may be associated with an increased risk of abruption. Sometimes anatomical anomalies can lead to abruption too. Just like here, I would like to mention this very interesting case report that was published in Hindawi Journal by Salino et al. In which placental abruption occurred due to torsion of the pregnant uterus. So there could be many different reasons of it. Diagnosis is mainly clinical. You have to completely assess the patient, take a complete history about the bleeding and rule out other causes of antepartum hemorrhage. You can watch my video of other causes of antepartum hemorrhage. I will mention the link below. To assess the patient, check for the general signs of shock, like tachycardia or cold peripheries or general pallor. Check for any previous scans that are available. This will help you reach your diagnosis. Do CTG if it is beyond 26 weeks, almost, or otherwise just note the fetal heart sounds to assess the fetal well-being. Always avoid doing cusco speculum examination or the pervaginal examination before ruling out placenta previa because it can cause a massive bleed. Study about the differential diagnosis, investigations, and management protocol of placental abruption in our next video. Thanks for watching.